I saw a video clip on Instagram last week, and it started with a clip of Florence Nightingale and what she did for aseptic technique. And we talk about what has happened over the last century in nursing. It is mind-boggling to think of where we're going to be in 25 years still. So there were 6 clips of progression of different things that nurses drove practice change, and where we would be if we had not encompassed that change and really accepted it and hardwired it. What we have to really think about with AI is how can we use it to be a benefit for our practice? So I see 2 different pathways. There's always the operational one, and some of the classes and teachings I've seen, how we're gonna change workflows, how we can create efficiencies, how that's gonna work along the multidisciplinary lines, everything from transports to patient rooms to equipment availability, what that's going to look like. But then there's the bedside piece, right? And so I think about how that is going to be incorporated in, and how wonderful it's going to be that instead of me having to look at an assessment and say my patient's status has changed and she's at moderate risk or at high risk, that actually the technology I'm going to be able to rely on, and when I am busy or challenged in trying to meet the needs of everything on the unit, I'm going to look up and say the status has changed because something has been recognized behind it that says your patient's at risk, go grab the postpartum hemorrhage meds, right? And so it's just an extra added level of safety, and I think we have to embrace that and really learn to work alongside it. So there are challenges for our bedside nurses to be able to get documentation done efficiently and accurately. And so if there's an AI component that can come along that could go ahead and take that burden off of them so that they could focus on the patient, it would be tremendous. And I really hope that something in the future can help our bedside nurses be able to get back to the bedside and not have to be at the computer or trying to stay afterwards to chart what happened 3 hours ago. That is, I think, some of the struggle and the burnout that the nurses feel, is that inefficiency. There's always a human factor. And that human factor is something we can't let go of. But we also have to make sure that we utilize what we have as tools to benefit us to have better outcomes. The rate of the morbidity, mortality that we have in this country, I think we have to look at all options in order to improve our outcomes and safety. And if AI is one of those innovations we can embrace, we need to look at it and be excited about it and how that's going to be able to help and enhance what we do.